everybody. My name is Christabelle, and I am the moderator for tonight's event. So thank you so much again for joining us on our catch-up stress management during COVID-19 event. And so let me just introduce to you about Silver Ribbon. Okay, so Silver Ribbon has been around since 2006, and the aim of Silver Ribbon is basically to reduce stigma as well as to promote a more positive attitude towards mental health. So this event is one of the few events that we hope to be able to achieve our aim. Okay, so with me today, we actually have a special guest, and he is Adjunct Associate Professor Cheng, who is the immediate past president of Silver Ribbon Singapore, as well as the vice chairman of the medical board at IMH. So thank you so much for joining us, Dr. Lee. Would you like to say hi to everyone?
Yeah. Hi, everyone. Good evening, everyone.
Okay, so like I mentioned earlier, we are having this event to hear from you guys, your concerns, your questions, anything regarding the stress that is that you feel because of the COVID-19 situation, and we're going to try and address as much as we can. So what we're going to be doing is, like mentioned in the chat group, if you do have a question, you can actually post it in the chat, and we will use it to address to ask Dr. Lee Cheng, and he will answer your questions as much as possible. Okay. So
I'll try my best.
Okay, thank you. So maybe to start, right, we can get Dr. Lee to tell us a bit more about what are his thoughts on the COVID-19 situation that's happening this time.
Okay. I think this disease outbreak caught us by surprise. It started somewhere end of last year, and since the end of last year until now, things have been changing quite rapidly. Earlier on, we were almost like what we call BAU, business as usual, but now we are masked up. We are not able to visit our friends, not able to visit our relatives. We are supposed to have a social distancing, and we are supposed, which in fact is a good behavior all this while, to practice good hygiene, personal hygiene. Shouldn't be coughing, sneezing in the public. If you need to, please cover yourself up, throw away the rubbish, the tissue paper, wash your hand, wash with soap. Don't anyhow touch your face, your nose, your body, that type of thing. I think things have changed quite a bit, and sometimes it's difficult for us to adapt, especially when every day there are new changes. Some of you may know that I'm also a justice of the peace. I do solemnize wedding, so I know a lot of couples are quite apprehensive about how to continue to get their marriage certified. Some have issues with the hotels, some have issues with the venues, and in fact, earlier this month, I was still allowed to solemnize a wedding of 10 people, maximum 10 people, but now it's on hold. So things are changing. People have to adapt to it. Definitely, we get anxious. We may feel restless. We may have insomnia. We may have difficulty coping. But my usual phrase is that this is a normal reaction to an abnormal situation. So what I'm trying to say is that you are not abnormal to feel having such a symptoms or having some of these signs. It's just a way we cope, and I hope if you do have any questions, we can discuss, we can do some form of a interaction later on.
Thank you so much, Dr. Lee. He mentioned quite a few good points, things like how, some of the symptoms that we can actually experience are things like anxiety, we can feel restless, we can be going through insomnia, and something that he said, it was very interesting, is how that, this is actually normal reactions to an abnormal situation. So, it's good, that you realize that there's nothing wrong with you. It's just us reacting to something that has not happened to us before. Okay. So like I mentioned earlier, if you do have questions, you can actually post it in the chat and we can address it to Dr. Lee. Okay. But in the meantime, maybe Dr. Lee, you can share with us what are some signs of stress to look out for, as well as how to manage them.
Okay. I think stress, whether it's because of COVID or because of financial reason, because of study, because of work, because of relationship, it can affect essentially many domains of our life, one of which can be behavioral. So behavioral can be things like we end up not able to sleep, we end up eating more or eating less, or we end up sleeping more. Some people may end up taking drugs, inclusive of alcohol, to help us to sleep, or taking some other medicine to help us to sleep or to help to cope with the stress. So this is purely behavioral. Then the other form is what we call physical. Physical means physical symptoms. So a person may start to have palpitation, which means the heartbeat very fast. You will feel racing, the heart, the pumping. And it will also be things like feel very fatigued, no energy, or breathlessness, that type of thing. These are more physical symptoms. The third type of symptoms are what we call cognitive symptoms. Cognitive means thinking processes. So you start to feel confused. You feel that you don't know what to do, at a loss. You feel that you cannot cope. You have poor concentration. You have poor attention. And the last group of symptoms are what we call the psychological symptoms. So one can feel anxious, panic attack. Some people may even feel depressed. But most times they have what we call depressive symptoms rather than what we diagnose as depressive disorder. To have a depressive disorder, or in a layman term, depression, usually they need to fulfill multiple symptoms like poor sleep, sleep disturbances, poor appetite disturbances, loss of interest, poor concentration, poor attention, poor energy, and they may even entertain suicidal ideations or even suicidal thoughts. But most important thing is when you start to call them a disorder or depression or illness, essentially they affect the functioning of the individual. So, for example, you are a housewife, you cannot do housework. You are a school-going kid, you cannot study. You're an adult working, you cannot function at work. So there is an impairment in the functioning. So not only the symptoms, the duration of symptoms, the severity of symptoms are also the impairment in the functioning.
So thank you, Dr. Lee. So he actually mentioned a few things. He told us that about 4 different kinds of symptoms that we can notice happening to us if we are too stressed out. There are behavioral symptoms, physical symptoms, cognitive symptoms, and psychological symptoms. And something important to note is that, the symptoms alone are not enough. They have to have some form of disruption to our functioning, to our daily lives, for it to be considered something that, you might require to seek help for. So, Dr. Lee, with all these symptoms, right, how do we manage them? If we were experiencing all these symptoms, how would you suggest we manage them?
Okay, first and foremost, I think it's important for us to recognize the symptoms are secondary to stress. A lot of people sometimes they may not recognize it, i.e., they do not have the self-awareness. I think that's important because if you don't know, you will never seek help. And I don't think all must come to see a psychiatrist and all must come to take medication. I think it's important for us, like we said earlier on, to be able to distinguish the mild, moderate, and the severe. The severe one probably have depression with suicidal ideations and even thoughts of self-harm or even attempts. So awareness is very important. Second thing is they need to know what are the stresses that cause them to have the symptoms. It may be a single stress, it can be multiple stress. In COVID, for example, it can be things related for work because some of the non-essential work are now being suspended. With that, people may have subsequent or consequent financial difficulties because work comes along with money. So you may have issue with financial. I know the government have been doing a lot. They have been helping us in terms of work and also in terms of financial support. And because of the stay-at-home policy or the directive now, at home you may have to double up both as a housewife, when your kids will have to go to school in a normal day, business as usual. But now the kids is with you all the while, so you have to do housework, you have to jaga the kid, you have to take care of the kid, or you have to work at home, and you have to manage both working as well as taking care of the kids, and not forgetting that it may be multiple things you have to do simultaneously. For example, you may have a Zoom meeting now with your employer or with your fellow colleagues, but at the same time, your kids may have a tele or e-learning at the same time. So how to cope with that? The other stress that comes from it may be things like interpersonal relationship problems. Because now you have more time with your family members. Sometimes you get to see their shortcoming, you get to see when they flare their temper, and that's where you may see some form of domestic violence occurring. So it's important to recognize where are the stresses. It may be just attributed to COVID, but it's more than just COVID. People may also be frightened by illness. For example, people may be worried about infection or being infected by others. So that there is phobia. So that may also be causing a person stress. So there is a multitude of stresses that one can experience. So again, it's important for the person to recognize it. I will give a few tips about how to maintain positive mental health at this moment. Personally, I think it's important for us, regardless of what, to continue to keep the same rhythm or same habits that we have been doing all this while. I think we are creatures of, we like things to be the same. We like a comfort zone. So I think even if you are working from home, it's good for you to wake up at the same time. I know you don't need to rush from the MRT or the public buses, or even you don't need to drive to work, but it's good to have a sleep routine as per usual. I think it should help you because our body have a what we call a sleep cycle, and the sleep structure, I think, is important. The other thing is continue to live a healthy living. Eat healthily. I think our body mechanism, our body immune system need to continue to function as such to be able to defend the virus, defend other form of stresses. Keep a regular sleeping pattern. Just because you are not going to work the next morning or at the usual timing doesn't mean that you have to sleep at 1 a.m. or past midnight. Keep a routine. I think that's very important. I will also say that for those who are maybe not working or those who have some free time, you may want to take up a hobby or do something that is able to attract your attention. Read a book, which maybe all this while you want to read, or watch a video or a movie online that you all this while you want to watch but don't have the time. So doing this can help you to focus your attention. I would think that it's important for us to also know a couple of simple relaxation techniques. This will help you to relax. You need not master those too complex things. And it basically help you to be able to tense your muscle and relax your muscle. You can do it from the top, from the head towards the toe, or from the other part of the body upwards to your face. So either way is fine. It's to basically the concept is to contract the muscle, relax the muscle progressively so that you can feel the tension and also feel the relaxation. And I think also importantly is because earlier on we mentioned we are not able to see our friends, our family members, our relatives. We are social creature. We want to have social interaction. So I would suggest that please continue to keep in touch with your friends, with your relatives, with your family members via a different mode, like what we are doing now. A Zoom meeting, a WhatsApp call, a audio call, a video call. I think that's very important. Keep the social interaction there, although it may not be physical, but a virtual one is still good.
Thank you, Dr. Lee, for sharing. So he mentioned a few things. Some points is keep your same habits, make sure you're still doing things that are your routine, to not have such a big drastic change in your routine. Do muscle relaxation because that really helps you calm down, as well as continue to keep in touch with your family members, your friends, just still have that social interaction, to continue to keep your positive attitude towards whatever's going on. So now what we're going to be doing is we're going to go straight into the question and answer segment. So like I mentioned earlier, if you do have questions for Dr. Lee, you can actually post them in the chat and we can ask Dr. Lee these questions that you post as much as we can. Okay, so maybe I can ask Dr. Lee one question first. So Dr. Lee, you told us all about how we can maintain our own, how we can manage our own stress. But let's say we notice one of our loved ones is stressed out. How do we support this loved one that is stressed out?
Again, I mentioned just now that the loved one may be stressed because the person is not able to cope due to change in the environment. It's important for us to have a listening ear, be able to understand, use what we call empathetic type of approach, so that we are able to stand on their see the points and able to stand in their shoes to understand what they are feeling. I think that's very important. The other thing I think is very important is the communication. Communication is very important because sometimes we take our loved one for granted. You know, our wife, our husband, our kids, our family members, we just assume, or even our friends, we just assume that they are doing well. We've forgotten that each of us, as I said just now, we are may present with abnormal situation. Under a normal situation, we present with a lot of symptoms. So these symptoms require people to talk about. So allow them to ventilate, allow them to express their emotion, and I think that is very useful. Sometimes crying is a way of expression of emotion, as long as there is a form of what we call catharsis, allow the person to express their inner feelings, is very, very useful.
Thank you, Dr. Lee. So you mentioned, we have to try and put ourselves in the shoes of our loved ones, as well as ventilate and let out emotions. Even something like crying can actually help us feel better. So again, like I mentioned earlier, if you guys have questions, you can actually post them in the chat, and we can get Dr. Lee to address them. Okay, so another question for Dr. Lee. So where and when and where, would I seek help if I'm unable to manage my stress during this period?
Unable to manage the stress.
Yeah.
I think there are a lot of resources online. Not most of the youngsters now, they are quite IB survey. They are able to look for information. I think information is also, there's another thing, go for the correct sources of information. I think otherwise we get confused because they are not on the website. There are people who advocate this and advocate the other thing. I'm not saying they're wrong, but I think you may have to look for more of the scientific-based resources or more evidence-based resources. That's one thing. The other thing is, after going through some of these relaxation techniques or procedures, you still feel very stressed. You may want to talk to someone. Beyond talking to your friends or loved one or relatives, you may want to talk to a professional, a mental health professional. I think Silver Ribbon Singapore is one of them. Okay, we have the resources, we have the manpower to outreach to people who are in need. Definitely, there are other resources that are available. I know the Singapore Association for Mental Health is also a mental health organization. We also know at this moment there is the National Care Hotline, which is established about 2-3 weeks ago by both the Ministry of Home and Social Affairs, Social and Home Development, as well as also the Ministry of Health and other agencies all coming on board. I think this is very good, both professionals from the public sector, from the private sectors, and volunteers come on board, and it's also a 24/7 hotline for people to call. If people do not feel comfortable with calling, I believe there are still resources available to enable us to see them face to face. But probably that will be for people who are more serious or require more urgent attention. Lastly, you may feel that your condition is serious enough that you want to see a psychiatrist or a psychologist. Again, in the private sector or in the public sector, these are considered essential services for people who are in need.
Thank you so much, Dr. Lee. So you mentioned a few things, that we can take note of, things like going online and finding resources, as well as talking to someone to see a professional. If talking to our friends or our own self-management tips are not enough. So thank you, Dr. Lee. So another question, Dr. Lee. So like you mentioned, like we talked about, self-care is really important during this period. We need to manage our emotions and manage our stress levels as much as possible. But now a lot of the activities that are conducted by the CCs and other places have been cancelled. So do you have any suggestions for us to practice self-care in the confinement of our own houses?
Yeah, I think a lot of things can be done innovative. In the past, we must always do things out of the house. I know there are something that we can't do within the house, definitely. Uh, uh, I would suggest open the window, allow ventilation, allow the air to come in. But suggest that you look out of the window, look at the horizon, look at the distance, get yourself exposed to the sun. I think that's important because some people feel that the moment you are at home, you are not able to go out, you do not have the energy. You can still do exercise at home. I mean, again, you can follow some of these exercises that are on TV or on the tube, on the internet. You can follow some of the thing. And I think the other thing what you can do is that do not forget that there are still things you can do with the family members. With the family members. Earlier on, we mentioned about reading. We mentioned about watching a movie. Or you can do some games with your family members. For example, you may have some digital parcel that you have kept keeping it in your locker or your storeroom for a long, long time. This time is probably the best. You must spend your time deciphering which one to piece to each other to form the picture that you want to do. Spend some what we call family time with each other, because a lot of time when we are talking about business as usual, when we are very busy, we go home, we just want to rest. We don't have time to interact with our family members. We have dinner. After dinner, we'll say, I want to watch the TV. After TV, I want to go to sleep. But now you have time to spend with your family members. I think look at it in a positive manner. I did mention earlier on that the interaction can also cause some conflict. But at the same time, if you look at it in a positive manner, it's a time for you to spend positive time or use meaningful time with your loved one, inclusive of children or even your elderly.
Thank you, Dr. Lee. So we have another question, because just now we were talking about how, being there for our loved ones is one way that we can support them. So this question is asking, if our loved ones do not communicate with us or do not want to share with us what's going on with them, how do we support them in situations like this?
Yeah, I think this is good because we earlier on we talked about activities. So sometimes the loved one or maybe the elderly, they may not want to tell the youngster that they have emotional problem. We always have this phrase thing. We don't have to tell our youngster that I'm depressed, I'm anxious. They will present with physical symptoms. So they say I'm breathless or I can't digest, I have a stomach pain and whatnot. So their presentation may, instead of emotional symptoms, they present with physical symptoms. So it's important for us to recognize this, that sometimes, as I said just now, all the four domains, they will present with other forms rather than just purely the emotional form. Second thing is, if they are not expressive enough or they are not keen to share, you can go through other methods like having activities together. You'll notice them to be slow. For example, in their concentration, I mentioned just now, one of the domain is cognitive, and there's a slowness in their working or in their judgment. So you can notice that. Or if they are not able to see enjoyment, or when you put a parcel together, you see that they don't have the enjoyment. You can notice that they are not having a happiness or joy. That's where you can help them.
Okay, thank you, Dr. Lee. So we have our last question for this evening. Now that my children have been doing home-based learning, I'm feeling more stressed and feeling less patient. What can I do to improve how I feel?
I think the youngster is always very resourceful. I would suggest that maybe you get your children to have their own so-called peer group, so they have interaction with their own people. E-learning doesn't mean that it's just the mother or the parents at home with the kids. The kids also do e-learning with their fellow students or the friends. So that's one way of having the separate time. The other thing is the parents themselves may also want a support group. They also may want to have a way of how to handle this situation. These are a couple of things that they can do together. separately, and then they can also do together as in the parents and children together so that they have more interaction.
Okay, thank you, Dr. Lee. So we've come to the end of our Q&A segment. Before we go into admin matters, maybe Dr. Lee, would you like to give us your last words?
I think there are a couple of things that maybe just now I did not share. First thing first is that at this moment, every day we are concerned about the figures. Some people will postulate what is the number today. Is it 500? Is it 700? Is it 1,000 and whatnot? I think we try to keep ourselves calm. The figure will come. Okay, the official figures will come. So don't spend too much time on all these things related to COVID. Otherwise, you get yourself anxious, overly anxious. You want to know. Everyone want to know. If you don't know, you also do not at a loss. You don't know how to handle it. I think it's important for us to manage it. Maybe 40%, 50% of our time is spent on COVID related. The other 50%, 60% is spent on other things that interest you. The other thing I also want to highlight is that we went through a lot of disaster before. I know we are a small country, but we went through SARS. We have other form of disaster, may not within Singapore, but Singaporeans have been affected, for example, the Asian tsunami. So all of us know that we will recover from a disaster or crisis. We will stay strong. We will need to understand how to be resilient so that in future, if there is a similar disaster of any nature, be it a disease outbreak, is it a Nico highway collapse, or is it something else? We are able to come together as a nation, as a family, individual, and resilience. I think that is very, very.
So thank you so much, Dr. Lee, for your last comments. You talked about how, if we can avoid it, we don't have to consistently look out at the figures that are rising or look out at the news. They will still come. We just make sure that we are not too stressed out about it, and also how we can get through this. We can stay together, we can stay strong, and we will definitely get through this situation. So thank you so much, Dr. Lee, again for sharing with us your thoughts. So before we completely end this event, sadly, maybe we can go into some admin matters. So Ryan, if you wouldn't mind, could flash our slide. So like Dr. Lee mentioned earlier, Silver Ribbon Singapore is actually conducting online emotional support, and we are doing it, to make sure that everybody and anybody that needs support can actually get it. So as you can see on the slide in front of you, we actually have 3 numbers that you can call, and we can do phone counseling or video counseling to ensure, that you do have the support that you need. And if you're experiencing any of the symptoms that's listed on the slide, you can always make a call and make an appointment for yourself and speak to one of our clinical executives. So what you can do is maybe you can take a picture of this slide so that you have it with you. I'll just give you a few seconds to take the picture. Okay, I hope that's enough time. If you do need more information, you can always email us at info@silverribbonsingapore.com. Moving on, just like this event, we're actually going to have another event that's upcoming. It is a Mother's Day special, and we're going to invite 2 artists, Mr. Manu and Miss Catherine Wong, who will be performing during this Mother's Day special. It's just another way for us to lift our mood during this period. So please save the date, 4th of May, 7:30 to 8:10 p.m. and do join us. You can also take a picture of this slide so that you have it with you. And okay, moving on. Like always, Silver Ribbon will also, we would love to, if you would like to support us and you would like to donate to us, you can always scan this QR code, and you can email the information that's listed on this slide for us to issue a tax deductible receipt. So, if you want to continue to support us doing the services that we provide and continue to support us in our efforts to reduce stigma and promote positive mental health, it will be greatly appreciated. So again, you can take a picture of this slide so that you have it with you. And finally, moving on, lastly, thank you again so much for attending this event. And we would definitely love to have your feedback. So you can actually use this QR code, or the link is also posted in the chat by our technical support, Ryan. So you can either follow the link or scan this QR code and do give us your feedback. It's really important for us so that we will know how to make better events, how to improve it, and ensure that we can still reach out to you in this online platform during this period, and have all of us come together and support each other during the COVID-19, so that we all have a positive attitude and a positive mentality as we go through this together. Like Dr. Lee said earlier, we're all strong, we're all staying together, we can support each other, and we can definitely get through this. So thank you all once again for joining us. A special thanks to Dr. Lee for speaking with us today and for giving us all these insights. So everybody, again, thank you so much. Have a good night and please stay safe during this period. Don't forget to join us on our 4th May event, okay? I'll see you all there. Bye-bye. Thank you again so much.
Bye-bye. Bye-bye. Good night, everyone.